Understanding the risks associated with medications is paramount, especially when it concerns our heart health. As we aim to navigate through the complex world of pharmaceuticals, it becomes crucial to know not just the benefits, but also the possible adverse effects of the drugs we commonly use. Today we delve into the heart risks linked to some widely prescribed medications, shedding light on how these everyday helpers could potentially turn into hazards. Our focus is not to alarm you, but to arm you with knowledge, so you can make informed decisions about your heart health. As we explore these medications, remember, knowledge is the first step in prevention. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, are a staple in many medicine cabinets, used to combat pain and inflammation. However, their impact on heart health can't be overlooked, especially for those with existing heart conditions. Studies have shown that prolonged use of NSAIDs can increase the risk of heart attacks and strokes. This risk is not uniform. It varies depending on the type of NSAID and the duration of use. If you have a heart condition, it's crucial to talk to your doctor about safer alternatives for managing pain. Additionally, always adhere to the recommended doses and be aware of the signs of heart distress. Alternatives such as acetaminophen may be recommended, though it's essential to consult with your healthcare provider before making any changes to your medication regimen. As always, moderation and medical guidance are key to using NSAIDs safely without compromising your heart health. Beta blockers are a common treatment for heart disease designed to reduce blood pressure and prevent heart attacks. However, for some heart patients, beta blockers might pose certain risks that need to be carefully managed. These medications can sometimes mask symptoms of heart distress, leading to delays in seeking necessary medical attention. It's vital for patients and caregivers to be aware of these symptoms and the proper use of beta blockers. Monitoring is crucial, and alternative options should be considered for individuals who experience adverse effects. Discussing with a cardiologist can provide insights into whether beta blockers are the best option given your specific health profile. Remember, the goal of medication is to help, not hinder. So regular checkups and open dialogue with your healthcare provider are essential. The connection between certain antidepressants and increased heart attack risk, particularly among the elderly, is a growing concern in medical communities. While antidepressants are crucial for managing mental health, some classes, like tricyclic antidepressants, have been linked to higher rates of cardiac events. If you or a loved one are using these medications, it's important to regularly review your heart health with your healthcare provider. Alternatives that may pose a lower cardiac risk could be considered, especially for those with pre-existing heart conditions. Lifestyle adjustments, such as increased physical activity and a heart-healthy diet, can also mitigate some of the risks associated with antidepressants. As always, never alter or stop your medications without professional guidance. For many women, birth control pills are an effective means of contraception. However, their impact on heart health cannot be ignored, particularly in women who smoke or have other cardiovascular risk factors. The combination of smoking and estrogen-containing birth control pills significantly increases the risk of heart attacks and other cardiovascular events. If you use birth control pills, it's vital to discuss your heart health and any risk factors with your healthcare provider. Alternatives that do not increase cardiovascular risk, such as non-hormonal methods, might be advised for women with higher heart risks. Remember, the choice of birth control should always consider overall health and individual risk factors. Proton pump inhibitors, commonly referred to as PPIs, are widely used to treat acid reflux and heartburn. However, recent studies suggest a potential link between long-term use of PPIs and an increased risk of heart attacks. This association is particularly concerning given the prevalence of PPI use. If you're using PPIs, consider discussing potential risks and lifestyle modifications with your healthcare provider. Dietary changes, such as eating smaller, more frequent meals, and reducing spicy and acidic foods can often alleviate symptoms without the need for prolonged PPI use. As with all medications, the benefits should be weighed against the risks, and alternatives should be considered where possible. Statins are renowned for their role in managing cholesterol and reducing the risk of heart attacks. However, they are not without their side effects, some of which may impact heart health negatively, such as muscle pain, which can deter patients from maintaining physical activity. Awareness and monitoring are crucial for anyone prescribed statins. Discuss any side effects with your doctor, as there are often ways to manage these issues without compromising heart health. Lifestyle changes, including diet and exercise, can also play a significant role in enhancing the effectiveness of statins and reducing their side effects. As always, a proactive approach to heart health, combining medication with lifestyle modifications, is recommended. Today's discussion underscores the importance of being thoroughly informed about the medications we take, especially concerning our heart health. Knowledge empowers us to make better health decisions and to engage proactively with our healthcare providers. If today's video has raised questions or concerns about your medications, I encourage you to consult with your healthcare provider. Making any changes to your medication should always be done under professional guidance. Let's remember, managing our heart health is not just about reacting to problems, but also about being proactive in our approach to wellness.